Now, we all know someone who's had cancer. You may be living with cancer yourself. As a patient, endless trips to doctors and specialists are exhausting, let alone having to go through detailed medical histories again and again with numerous medical professionals. Now, a new national directory in New Zealand will provide patients, doctors and researchers with a hub of shared information to save time, stress and money for all. Cancer Society Chief Executive Claire Austin joins me now. Claire, thanks for joining us this morning. How big a difference will this make to people sort of who are going through cancer treatment?
Well, I think the ministry deserves a pat on the back for this one, actually, Paul. Finally, it's something where you're putting the patients and their families in the centre of care.
How hard has this been for patients up until now? Because if you haven't been through this, you perhaps don't recognise the amount of stress that it causes constantly explaining the situation.
Oh, look, I've witnessed it firsthand myself, and seeing family members who are discharged from hospital and then find they're having to explain their medical history through to the next caregiver. You know, it's a busy sector out there. There's lots of people trying to do the right thing. So it's really going to help patients and, you know, through their cancer journey and their families. But it's also going to help health professionals do a better job.
When will this kick in? When will it be up and running?
Well, my understanding it's building over the next 5 years. So obviously we'll watch with great interest, but we think that certainly the idea and the strategy is on the right path.
Claire, what's the state of play with cancer treatment in New Zealand at the moment? Because over the years there have been issues, haven't there, with the times of treatment, and I know the government at the moment are trying to focus very heavily on shortening those treatment times as much as possible, getting treatment to people at the right time.
Well, I think that there's a number of issues still in our journey. It's great that we've got shorter treatment times, but we also really want to get a lot more into early intervention, because that's where we can really make a difference. So rolling out of the bowel screening program is a really important initiative. Other things around making sure that information is shared properly between health professionals. There's some really, if you like, groundbreaking treatments coming on the market around immunotherapy, but that's a real challenge for us as a country, and for a global challenge for patients in terms of access to these sorts of treatments.
Okay, well, let's focus on one of those now, pembrolizumab, which we talked about, I suppose about 2 weeks ago. This was very much in the news because it is one of those absolutely breakthrough treatments for cancer, in the first instance for skin cancer, but also it shows potential for lung cancer. The big question is, are patients missing out because it isn't being funded? And the answer would seem to be yes.
Well, if we take a step back, it's that you'd have to be a millionaire to be able to afford the drug. So I think we even have to look at this even more widely, that this is really exciting science. You know, it's groundbreaking stuff. It's life-changing and life-saving science. But the issue is that it's so expensive. And so it's not even just the issue of access, it's the issue of affordability right across the world. So I think we've got some questions to ask, not only as a country, but I think also pressure globally as to, you know, when these treatments come on the market, how do we make sure that the people that they're there for actually access it when they need it?
Are able to access them, yeah. But in the case of pembrolizumab, which is interesting, isn't it? It is seen as a truly breakthrough product, a breakthrough treatment, in that it actually does cure people in about 10% of cases and dramatically improves people's lives in a much greater percentage than that. I mean, surely this would be something you would expect to be funded, and we know it is funded in Australia. Funding will kick in very shortly there. It's funded in the United States.
We know that it actually costs nearly $200,000 for a course of treatment. So I guess that's the question. I'm sure that the will is there. What we hope as a country, and I hope for people that need that drug, is that that's going to be affordable so that we can purchase and make that available to people in New Zealand.
Claire, thank you so much for joining us. Cancer Society is celebrating 25 years of Daffodil Day next month.
We are indeed, and I think it's really important to remember that the Cancer Society doesn't get a penny of government funding. Everything relies on donations, so it's Kiwis that keep us doing the good work. So it's all about care and comfort and hope for people who are affected by cancer. So we always value your support.
Fantastic. Thank you very much, Claire. Claire Austin, Cancer Society Chief Executive, 25 years of Daffodil Day. You know, I have my eldest daughter is an oncology nurse in Melbourne, and she said that, and quite often the hospital that she works in is sort of state-of-the-art cancer hospital, and they trial drugs all the time. And she said this new drug for skin cancer is not like any other drug they've ever trialled. It instantly works in some cases, and it totally transforms people's lives.